Dr. Microine answering the question, what should I expect during a vascular ultrasound? Well, first of all, I'd like to clarify there's different kinds of vascular ultrasounds. One is an examination of the arteries in the legs, and the other is an examination of the veins. People wonder, well, I just got an ultrasound last week on my arteries. Why do I need one on my veins? It's because we're actually looking at a completely different part of the anatomy. They're actually quite close to each other, but the ultrasound machine is so precise that we're looking literally a quarter inch uh, apart from each other, and we have to do lots of analysis of the artery versus the vein. So we actually segregate out arteries from vein ultrasound. So that's why they're separate. And of course, that's different from other kinds of artery ultrasounds, which includes the carotid, which is in the neck, and an aortic ultrasound, which looks for aneurysms. But in terms of a vein ultrasound, what we're looking for is whether the veins are functioning normally, which is a examination for what's called reflux, and also do you have any evidence of old blood clots, current blood clots or old blood clots, and those are the main focuses of the exam. So to look for reflux, the standard approach now is to do a standing reflux ultrasound exam. That involves having the patient stand, usually on a little stand. The ultrasound technician will look at the veins with an ultrasound probe, and the ultrasound probe sends tiny ultrasound waves that bounce off the tissues under the skin, and then it's interpreted by the machine and recreates an image of what's going on under the skin. It's quite remarkable and quite accurate. So this standing exam is very important to determine whether there's abnormal circulation, because the time when the abnormal circulation in the veins is present is when people are standing. It's not when they're laying down. If you have a reflex exam when they're laying down, most people will not have an abnormal finding, but they will if they stand up, for people that do have a vein condition. So we really have to do the exam standing up. Looking at the deep veins for blood clots is a separate part of the exam. That's usually done laying down. In that exam, they're looking at the veins, usually starting from just above the groin all the way to the ankle. And there are specific veins that are examined, but usually the entire stretch of veins from the groin to the ankle is examined. And what the sonographer is looking for is evidence that there is either a acute clot, which is something that's been present for just a few days, or something that's been present for several weeks or longer. And there's findings on the ultrasound that give us a clue as to the age, and we're looking for those ultrasound clues. And we're also looking for areas where there's no blood flow inside that vein. If there's no blood flow, that usually means there's a blood clot in there blocking it. So this is how an ultrasound works. It takes usually about 45 minutes to an hour to accomplish, and is painless and can give us a lot of information about the vein circulation. So Dr. Mike Owen answering the question, what do I expect during a vein ultrasound?